you guys to another episode of the Unraveled and Rising podcast. I have to give ourselves some credit and congratulations because we completed our first 10 episodes.
Woo!
This is episode number 11. Woo!
Yay!
Yeah, so that's an accomplishment because it is a commitment. Those of you that do a podcast or watch podcasts, I'm telling you, it's a commitment every week to do this, and we are honored to do it, and we're happy to do it. But we all have busy lives, so the fact that we continue to be committed to this, we want to congratulate ourselves, and thank you so much for listening. We really are watching. We really, really, really deeply appreciate you for sure.
Yes.
So today we're going to start a whole new series because this is a concern that Terry and Kimberly have been talking about for a long time with me and with others, and we want to start talking about this on the podcast. We're not going to do it every week on this particular subject, but we will be having guests and be talking about various aspects of this concern that we have. And we're hoping that by doing this, talking about it and bringing people in that can have conversations, that maybe we can make a change, however small, whatever it is. Hopefully that is our goal, that we can make a change. So we're going to start talking about the healthcare industry overall. And I don't have the knowledge that these ladies have, that is for sure. So I'm going to let them talk about their concerns about healthcare and how we need to make a change. I don't know which one of you guys want to start, but can you give an overview? Maybe Terry, just give an overview of what the big concerns are and what you're seeing, and then Kimberly chime in, or we can wait. This is a big deal for me as a patient. This is concerning because I'm on the patient side. So are you guys, but I'm just seeing it solely from the patient side because I have no perspective from the healthcare side.
Well, and I think it's good because Terry's got from the inside, right? I deal with people from the discharge who once they get home, and then we've got a patient. So this kind of gives us full spectrum.
Yeah. So Terry, do you want to kind of talk about what you're thinking?
Yeah. So the concern for me is, there's data out there, and Michelle, I'll give you the link of the article that I'm talking about, so that you can put in the show comments of this,
okay,
so that they can follow up on it. But there's just in Colorado alone, it is predicted in 2026 that there will be a shortage of 10,000 nurses just in Colorado alone. And just to give you an idea of what that means for a hospital to run an organization, the largest professionals in the healthcare industry is registered nurses. We are the largest amount of healthcare professionals within that realm of professionals. And we are the ones that keep that hospital open, to be honest with you. We are their frontline professionals. We are the ones that provide the care for those patients. So that hospital does not run without registered nurses. Doctors can write orders. They can't give medications. It does not run without nurses. So that is a significant, that is a challenge. That is a large number. And when you think about that, just in Colorado, you think about that globally and nationally, that is a lot of nurses that are not returning to the profession. And when I think about that, it breaks my heart because to me, nursing was a calling. And I believe people are called into this profession. And I believe with their whole heart, they do it because they love, and they're healers, and they care about people, and they want to bring change. But I think that, from a macro level, from a larger part of the healthcare organization, it's harder to do that when you have big, pharmaceutical companies, and you have large insurance companies, and quite honestly, when you have political people involved. To me, I think that political parties should be completely out of it. I don't think that they should have a hand in healthcare at all. I think that it's about people, and that's where it should be left, is about people. And so, but also I wanted to back to COVID-19, is when COVID-19 happened. I think that it exposed a lot of things within healthcare, where we didn't have everything together. And it exposed a lot of areas of where we needed to make some changes. I don't think that COVID-19 was a bad thing for healthcare. I think that it exposed some great areas that need to shift. So to me, I am very optimistic that this is I think we're in the midst of a great revolution in healthcare. I think it's going to take some time for us to get there. But the thing that I want to focus on is keeping our healthcare providers healthy, mentally, physically, so that they can stay within the profession, and that we can continue to attract new nurses to come out and stay with the profession, so that we can keep bringing people into the profession and care for an aging population, because we have a profession, we have people that are living longer and are living with longer, more chronic diseases that need to be managed. And I've always say this, we've always disconnected in Western medicine, mind, body, and spirit. And we are finding that they are interconnected. We are interconnected beings, and it is mind, body, and spirit. And I believe that it's taking some time, but I believe that we are starting to find that. I think there's data to prove that we are mind, body, spirit, and that they are not disconnected. They are not disconnected. They are very much interconnected. And so, but we are not also, nursing is also not superheroes with capes, right? We are not superheroes. I think back to COVID when they had these pictures of a Superwoman and all these pictures of us, and that was an unrealistic expectation of nurses. And I think that we held that with a badge of honor and said, oh yeah, let's go out and care for these people, but we didn't care for ourselves during that time. And what I don't think people understand is that working in healthcare in the hospitals, we might walk out of a room where somebody just coded. And we might walk out of a room where somebody just got a terminal diagnosis. And we have to walk back into the next room, and we have to put on a straight face and carry these things with us. And so how are we caring for ourselves? And when I first came into nursing, there was no emphasis on this. It was pick up an extra shift, do this, do that. And there was no, work through your break. Don't take 5 minutes to go use the bathroom. It was not, how do we care for ourselves? How do we take 5 minutes to show self-love? And what does look like caring for yourself look like? And so I love that right now they're putting more emphasis on that and showing nurses that you are human and you're not superheroes. You actually do. You're human as well. And you do have emotions, and you do feel when you walk out of a room and someone's had to lose their loved one or get a critical diagnosis that you take home. And you have to bear burdens for people sometimes. And I think that I don't think people understand that we carry the weight of that for others.
And just to be clear, Terry, nurses are leaving the industry because of stress and burnout and that kind of thing. Is that why they're leaving?
Yes. And because we've never really learned how to care for ourselves. Stress, burnout, I think the hospitals can they're starting to get better at learning how to do debriefs, and when there is a code, how do we do a debrief and bring the whole team together and talk about it? How can we get away from where management's around and just get with the case management, just get with the social workers and say what went well and how are you feeling about this? And my particular organization, we do work on this, but I'll tell you what, I've worked with organizations that they're not doing that. So I do respect my organization because I have seen, this is the one organization that I have seen that, where a sentinel event or a workplace violence event happens and they're saying, we're going to get together and talk about this. And there's going to be a debrief and we're going to talk about how can we make this better? Is there some things that we can put in place that this doesn't happen again? And if it does happen again, how can we take care of ourselves? So the conversations are starting to happen.
Well, one thing I will say, when I worked trauma, some of the trauma units I worked in, they were really good. Some of the chaplains were, about getting us together after something, because I remember being like, no, I'm okay. I'm okay. And this one chaplain being like, no, you're not. Let's get in here. Let's debrief. You're not taking this home. So, and working in several different units throughout the hospital that I worked in, trauma was really the only unit that I had experienced. And you experience trauma all over the hospital as a nurse, but that was the only unit that I felt supported in that.
Yeah, and it's got to be all units.
Yep.
Everybody's got to get on board. But then the other thing, and you just hit on it, Kimberly, it's nursing has to also change their perspective. It's not just, organizations can offer all this stuff, but there's also got to be a mindset shift within nursing. Like the nurses have to change the way we think and the way we've always dealt with things, because we can't always just carry it. Because when we think we're going to be okay, 6 months down the road, burnout starts to set in, and burnout. When we're talking about burnout, we're talking about all of a sudden you're dealing with patients that are sick and carrying chronic illness, but then all of a sudden that heart and that compassion for them sometimes kind of starts to get really callous.
Yeah,
and you're not showing up as good the way that our patients deserve us to show up. And be the advocate that they really need us to be, right? We don't think the way that we should. We miss things where we wouldn't miss things before. That's really critical and can actually change health outcomes for patients.
Well, I know for me, it would affect even how I interacted with my children when I got home, if I was just burnt out, or how I would respond to my husband, or how I would react to somebody that cut me off in traffic. I mean, it affects everything.
Mm-hmm. It does.
We don't have to talk about it in detail, but just from a macro perspective, like you said, Terry, what is the result of us having a shortage of nurses to the world that goes and needs that service? What is the result? Closing down hospitals, or what is?
Well, I don't think that it means that staffing shortages. So it means that nursing ratios are bigger, or nursing ratios are higher. So it means that that nurses are taking on higher acuity of patients. And so, what that means is that a nursing ratio means that there's one nurse to a higher amount of patients. So that means that the quality of care that those patients get from that one nurse is not going to be quality care. And that is the true fact, not because, and that to me, when I say that, it means that nurse is working out of alignment with the way that she wants to work, because, and then that's where burnout comes, because when
it's only increasing it for them. Those nurses have.
Because when you show up for your patients, you want to give excellent care and you want to spend the time that your patients need with you. But when you are stretched thin and your patient ratios are higher and your patients' diagnoses and they're sicker, it means that you can't give that quality care. And so, and when you can't, that puts a lot of stress on that nurse.
And that increases the risks of mistakes, medication, accidents, nurses refusing to treat because they're going to refuse to work in this type of environment too. So then what? They're looked at like they're the villain, but they fought hard to get that license and, want to be here to help and to serve, but not if you're, being bombarded and, you're liable. Nurses are getting sued. I mean, it's just, it's not good.
Yeah. And then that's where you see in Colorado alone in 2026, that's where you see a shortage of nurses of 10,000, because it's not, we're not making it attractive for people to come into nursing.
Right.
With that, so there's gotta be something done.
Well, or even to stay, as you age, you're a seasoned nurse, you're, you know what you're doing, you're a stronger nurse, but then you don't want to be busting your back. I stopped doing bedside, 8 years ago because of that. You know what I mean? So people that are, 60, they're not going to want to be in that field anymore. and then attracting new people. It's, and money, they try to throw money at you, but that's not what we want though either.
Well, and I had someone say that to me one day. He said, "Oh, well, you're just making all kinds of money doing this." And I just went, if people went into nursing for the money, they wouldn't stay long.
No.
It has to be more than money. You really have to love what you do. To me, I do believe it's a calling. It's got to be something more that keeps you there, because you wouldn't stay there.
Right.
It's more than that. And in this age, we're also seeing a lot more patients with Alzheimer's. We're seeing a lot more patients struggling with Alzheimer's, also with comorbidities, which just means that they have multiple diagnoses of healthcare illnesses that they're dealing with, on top of mental health challenges, which is Alzheimer's, but also other things like schizophrenia, bipolar, anxiety, PTSD, and then on top of that, addiction. You're also seeing people come in with substance abuse, and these are people in their 70s and 80s that are coming in with all of this stuff. So it's compounded. So it's multiple diagnoses. It's mental health, substance abuse, and then you add Alzheimer's to all of this. So sounds
like a recipe for disaster.
Well, these patients are very complex. They're very complex. And then with healthcare, with insurance, they're covering a lot less. So you're advocating for patients to get care, and they're covering less and less and less. And so it's very challenging when you are trying to advocate for patients, but you can't get them the care that they need.
Yeah. That would be hard. I get that. And then thank you for that, Terry. That's a good description. And we're going to have people, we're going to talk about this further. We're going to dive deeper into this kind of stuff, like exactly what Terry is talking about. But I wanted to hear it from Kimberly's perspective in regards to, the discharge side, and when they get out of the hospital, because she has a care registry, or she is, not only has her own patients and people that she deals with, but she has a registry where there are caregivers are taking care of them as well. So what are you seeing from that side, Kimberly?
Well, I'm seeing a lot of dropped balls, where, it used to be when you left the hospital or rehab or wherever it was, that the case manager, the social worker, whomever would set you up to go home, whether that set you up for home health or set up even your follow-up doctor's appointments, things like that, so that when you get home, you can, continue your care to continue getting over whatever ailment you have. And what I'm seeing now is that they need home health. So they're sending out multiple referrals to these different home healths, and then sending people home, meaning they're not confirming that these home healths are going to be able to take these people on, or that they have the staff to take these people on. So people get home assuming they're going to hear from their home health to start the physical therapy, start their nursing, whatever they need. Just number one, they don't know who it's supposed to be. They're waiting for a phone call. So they're calling me sometimes a couple days later, telling me, the story, they left the hospital, and then I'm following up and finding out that, these companies never accepted them. So they never are going to assume that care for whatever reason. Maybe they needed physical therapy and occupational therapy, and they could only provide physical therapy. So, so those types of things, or that their medications were sent to the wrong pharmacy. It's just not being taken care of the way that it needs to. In follow-up appointments, you're supposed to be able to follow up with your doctor within 10 days. Well, some of these doctors are backed up for months. So you're getting out of the hospital, you need to follow up. Oh, well, you can't see your doctor for 3 months. What? Like there's no continuity of care. It's just dumping it off my desk. It's not my problem anymore. Let's get them out and let's move on to the next patient, is what it feels like.
And this goes to a shortage of staff. and people not coming, a lack of providers coming into the profession. There is a huge need for home health nurses because there's not enough home health nurses. So again, 10,000 shortage of nurses in Colorado alone. We need home health nurses to run a home health care agency. And when there's not home health nurses to hire to provide care at home, what are we doing? There's not enough. There's not enough nurses already. So this is what we're talking about: getting our keeping our nurses healthy that are in it, but then also how are we keeping the industry attractable? What are we doing to retain nurses and to get good nurses in there? How are we training them to be more trauma informed? How are we training them to take care of themselves so that they can sustain a career like Kimberly and I that have been more than 20 years and almost 20 years, one more year, to stay in the profession and still love what they're doing, right? How do we do that? Because that is not happening right now. And so I think that at some point, healthcare organizations got to take some type of responsibility for this and figure out how do we play a part in this.
Yeah, 100%. And then Kimberly, as far as the home health care side and what you're talking about, do you see a path moving forward where there could be skilled nursing care that could benefit the home health care side? But you can't even do skilled nursing as a registry, right? So that's a whole separate ballgame.
Oh that's non-skilled. So yeah, home health would be where you would get that skilled nursing, which, like Terry said,
and you have to be referred to that, correct? You can't just get it yourself.
And it's got to be the right insurance, and even the services that they're offering is less. You used to be able to get a nurse to come out, review your medications, fill your pill box for you, or you're being discharged from the hospital and maybe you need antibiotics for 7 days IV. Well, Medicare, if you're lucky, says, okay, we'll send a nurse twice and you need to find a family member that can do this. Well, there's a lot of family members that they don't feel comfortable doing that, even if they're taught twice.
Or I just had a gentleman this week that had no one to live with him, and he had to get himself to the clinic. Mm-hmm. And I can't go into all the things that were wrong with him, but he couldn't physically get himself to the clinic. Uh-huh. And so comes back and now facing sepsis.
Right.
Because he couldn't get himself there. So there's so many barriers to care. But you just said something that is so huge, and I just want to tell our audience that if you have loved ones, aging parents or grandparents, or you're the aging patient that is, maybe transitioning out of the work environment, and you're going to be looking at some of these retirement accounts. Read between the lines of the insurance that you are going to be taking. And when they are offering you services and promise you the world, you make sure that you read what they are going to pay, because they offer you the world and they don't deliver. And then you end up with no coverage. So you've got to do your due diligence.
Yep. And find a good broker. There's a lot of good, especially when it comes to Medicare. I mean, there's a lot of good brokers out there that are very experienced and they can take you through that. But you've got to kind of know the questions to ask sometimes too. And because they make things look really sexy sometimes. Oh, you're going to get free transportation. Oh, you're going to get this, you're going to get that. But they don't tell you all the things that you're taking away from you in order for you to get that $10 transportation ride.
And this gentleman said that. He said, if they would have told me that I was not going to get this anymore, I would have stayed on the insurance that I had. And he was actually getting such less coverage. And his particular insurance didn't even cover home health IV infusion at all.
Yeah. I got to tell you guys a funny, just in regards to this. I take care of my cousin. I manage the care for her. She has in-home care, but she went to they thought she had a UTI, and she went to the hospital on Friday. I had a caregiver take her to the hospital. She goes to the clinic across the street. It's not part of the actual hospital. It's a different building. It's, it's private, it's just, they don't have to, it's not the main hospital, which is Sanford in Vermilion, South Dakota. So then home health calls and says, hey, she's been referred to home health. And I'm like, great. So they go out and meet with her yesterday morning, and she denied the services. So they called me, and she said, and it's, it's paid for through Medicare. And so I called them. I go, she's got dementia. I said, I am her medical power of attorney, and I'm saying she does need the services. So we need to, and so I called her and I said, hey, Marsha, I heard you denied the services. Oh. And so I talked her into it. I'm like, we're getting services, girl. If you're going to get free services for 6 weeks or whatever, we're doing it.
Yeah. 100%.
Sorry. I'm overriding your decision.
Yes.
I know. 100%. It's just crazy, that kind of stuff. But this is good. And then I wanted to just talk briefly too about kind of the impact on patients like me. If you're unable to, and I always keep thinking of the Canada model, because they have their healthcare is paid for, but they get taxed at 50% or 55% or whatever it is. But they have to wait months to get an appointment. Like he had to wait like 3 or 4 months just to get an appointment. So how is it going to impact those of us in the world, the patients, this scenario? Like, can you give us an idea of how this is going to impact us?
So I will tell you, I have a friend, my really good friend Claire. She's from Nova Scotia, and so she has a sister that lives in Canada, and it took her a year, 12 months to get approved for a surgery. So it is much more than 3 or 4 months. It is very, very long.
I mean, just for a regular doctor's appointment, not a surgery.
Yes,
just like to get a regular doctor's appointment.
It is very, very long.
Yeah.
Well, and we've hit on the nurses, but there's also physicians leaving the insurance world too. Yes. They're going more to the concierge world because they want to practice medicine. They don't want insurance to be dictating what they can or cannot do. Yes. So that is going to hit us as well. Because if you don't have the luxury of being able to afford a concierge physician, you're forced to stay in the insurance model. And like for me, I'm in the insurance model, but I also have a concierge physician because I want the test run that I want. I want, I just want some more of that flexibility. But if you don't have that ability, now there's also less doctors. Neurologists now, new neurologist appointment, you're waiting 6 to 8 months. We've got patients with dementia, things going on. Okay, yeah, 6 to 8 months. Really? I mean, people could literally be dead by the time they get to the doctor's appointment.
Yeah.
And that you hit something on the head there too, Kimberly, which is this is the way that we keep, separating ourselves, the rich and the poor.
Yeah.
Because this is an example of the services that are people that can afford, these kinds of things are going to get the services, and people that can't afford it are going to be stuck down here without services and having more issues. It's another way to kind of put a separation between us in that way.
Well, and I'm not rich by any means. I just want to put that out there.
Yeah. But I know what you mean.
Yeah. But you sacrifice different things for, what's important. But it's, people on a fixed income, it's not even an option. I mean, they're debating whether they're going to eat or buy their medications.
Yeah. And that's so true. You're watching patients reuse home care supplies because they can't afford to get new ones every single month.
Or eating their cat food.
Yeah.
Because they can't afford food.
Taking half of a tablet of a diuretic because they can't afford their medications. Yeah. And so, and even like with new diabetics, a young person comes in and gets a diagnosis of being a diabetic, and then the insulin now is so crazy. I just can't even believe the cost of it. And they don't take their diabetes medication, and then they end up in DKA, which is diabetes, diabetic ketoacidosis, and it's terribly high blood sugars. And they end up in the ICU, which is way more expensive to have an ICU stay in the hospital or in the progressive ICU, or just a progressive care unit, than to just get these patients some medication so that they could manage their diabetes. So I don't understand the rationale behind it. That we're to me, those are not good outcomes.
Yeah.
Not helping them and then having them come into the hospital. That it's not a good use of our services on a healthcare system that is already strained for nursing.
And then that goes into what we're putting in our mouths, right? What we're eating, the ultra processed foods, and all of this crap that is causing people's blood sugars to be high, causing people to be addicted to carbs, and all of these things. So, controlling the controllables when you can, but to go back to talk about, a financial point, some of the, if you don't have the money to buy organic foods and better foods, you're eating the less quality foods too, which are then causing disease. So this is a vicious cycle. Other countries aren't dealing with this. So what the hell is going on?
Well, and I love this part of it because I think it's a really great opportunity for nursing to come out, even on social media and on these podcasts, and take some topics and really become advocates for our community and do some education. And how can we become a value to our community locally, and just help you guys stay healthy and focus on wellness and prevention, and keep you guys out of this whole healthcare system. What can we do to share just some tips to be able to keep your health and wellness and prevention, not get into these vicious cycles of needing healthcare services, because that is possible.
Mm-hmm. It is.
It also talks to trauma, and what we're with this. The reason we started this podcast in general, Terry, is because there is a connection with mind, body, spirit, just like you said. This trauma is also impacting us. It's impacting our bodies. It's impacting our health, and the fact that there are so many people that are not dealing with those internal traumas is also having an impact. Just stress alone. If we just talk about the stress part, and that's not even really necessarily trauma. It could be, but it doesn't have to be. Of whatever, the impact that has on your body is amazing. And the fact that if you don't try to somehow deal with the stress or manage the stress, that alone, but just think about all the trauma that people are carrying in their bodies, and that's going to impact them. So it's another reason why it's so important to deal with this trauma stuff, so that that doesn't contribute to you having to go into the hospital long term or something like that.
I mean, that alone will raise your blood sugar.
Yeah.
Stress, cortisol.
What will? Yeah,
absolutely. Every time somebody comes in the hospital, their blood sugar's higher just from that event.
Yes.
You know what I mean? So it's all of those little hits, those little T's, right, Terry? Just those little hits, those little hits. And
so and we talked about this before, but there was a study done in the 90s, the ACEs study. I talked about this, and I share it with the women every session we do at the prison. And it's called the Adverse Childhood Experiences Study. It was done by a physician in San Diego, Dr. Valente. It was one of the largest studies that they did. Kaiser Permanente did it. And it was a weight loss study. And they couldn't figure out why people were losing weight and dropping out of the study. And it was more than about the weight. It was actually, he went and started interviewing these people, and it was a link to trauma. And they were actually using food as like a coping mechanism, really. Yeah. And what they found is that the link to trauma, these people, and there's various reasons. So it can be sexual, verbal, lots of reasons. There could have been an incarceration from a family member, divorce. Yeah. Had you ever seen your mom abused by a partner? Was it, did somebody struggle with mental health illnesses? But there's a link to adverse childhood experiences. And this is from the ages 18 and below, that if you ever experienced any of these childhood experiences, there is a link to a lot of these comorbidities later on in life. Right. And it's all cortisol. It's all this over cortisol production. And it leads to diabetes. I mean, more people had diabetes. It was linked to diabetes, cardiovascular disease, sexual promiscuity. Can't say that word.
Promiscuity, yep.
Substance abuse. I mean, all the things, and it can be linked. So trauma is a direct link to a lot of these things. Fibromyalgia, autoimmune diseases, where they can't find a reason. Trauma is a link to a lot of these things. And when I did my nurse coaching certification, I learned a different way of practicing in the hospital. And I tell you, when I go in and just start asking some questions, and again, this takes time, not being able to have 5 to 6 patients, but when you have some extra 5 minutes and you just say, hey, tell me a little bit about your family. And you start to get an idea of their upbringing and how relationships were within their family, you start to get a really good idea of where some of this stuff is coming from. And so there is a direct link. And now there's just data that's starting to prove it.
Mm-hmm.
Fascinating. Yeah. And I just, if there's a way, do you guys even have ideas of how we could make an impact on the concerns you have about the healthcare industry, or is it so big that it's too much to deal with?
I don't think it's too big that it's too much to deal with. I think it first starts with awareness. I think I have a lot of respect for my organization because I do believe they're chipping away at it. What I do see is some resistance with nurses. And there's a handful that are buying in, but there's some that are like, and buying into this meditating and self-care and things like that. But there are some that are really buying into it. And I think the more and more that we start, as you guys know, I went back to school, they're starting to bring it into the curriculum. And so as they're starting to teach nurses the importance of self-care and are adding it in, I mean, it was homework for me to do some of these self-care practices and stuff. And that wasn't in my original nursing program. I believe as we begin to do that and we begin to show nurses the importance of it and how important it is to show it for ourselves, I think that we're on the cusp of a shift. I think that there's a lot of great things coming into nursing. And I feel very excited to be a part of that into this new next generation of nurses. Because I believe it's happening. I believe there's a lot of great things coming. So I do think it's possible. I really, really do.
And I think that the first thing you could do effective immediately is start taking responsibility for your own health.
Yes, 100%.
You can choose what you put in your mouth, how you move your body, what you put into your mind. If you're hydrated, so taking responsibility for yourself is the first thing that you can do effective immediately.
Yeah.
And hopefully avoid needing to be into a hospital or needing to, get yourself in that sort of a situation.
And partner with your healthcare team. Like be a participant.
Yes.
Don't just come to them to fix things. Like be accountable to the choices that you make and be a participant in your care. Like help them help you.
And if you don't feel comfortable or you're not being listened to, then find a different physician. And that's not your physician.
Right.
Some of the things I've heard recently, some of the ways that a good friend of mine has been talked to by multiple physicians. I mean, I felt like I was picking my jaw off the ground. Like I just could not believe, literally told her, I have 7 minutes with you. Your time is up. You'll have to make another appointment for us to talk about that other issue. And I'm just like, what the hell? But again, that's the insurance, right? And he's got so much time that he has to see all these people and who suffers, the patients. And I told her, I said, well, then that's not your doctor either. She's like, but this is number 4. I go, well, then maybe 5 will be the lucky one. But I mean, truly. And that's
And the other thing is, there's so much literature out there that you can learn a lot of things on your own. Don't go to Google and Wikipedia.
No, please don't.
There's lots of evidence-based things that you can, journals, like the American Nurses Association. There's a lot of medical journals that you can go and get information on things, but do not just Google something and literally take it as advice. So you can learn a lot of things on your own, but consider the source, and make sure that it's evidence, that there's evidence and there's research that can be backed up with the stuff that you educate yourself on. And I encourage that. There's a lot of research out there and a lot of literature that is available to everybody that you can just go find on your own.
Yes.
And patients are, I do have to say, much more educated than they used to be. Not everybody, but a lot more are, which I feel is a good thing. And that is part of being responsible, for your health. So yeah, absolutely. And there are a lot of good podcasts too that have doctors that have years of experience. They're using that as their platform to get their message across.
Lots of good doctors and good podcasts out there. Absolutely. So the information's out there. There's a lot of good information out there that you can take control of your own health and
your own advocate.
Absolutely. You got to be your own advocate.
And it's it doesn't matter how old you are. Mm-hmm. I mean, it takes time, but you can reverse things. You can reverse, depending on the type. I mean, there's a lot of things you can reverse.
There are.
Does the bird have anything to add?
She's back here squeaking, talking to Alexa. So she's learning how to say Alexa. She's saying Alexa.
And she's wondering why she's not getting a response.
Right. Where's my Disney songs?
Does she have anything to say about healthcare?
Do you have anything to say about healthcare, MZ? Give me raspberries.
It's like mic drop.
Raspberries.
That summed it up nicely. Thank you.
It does.
I love this topic, you guys, because I think this topic is the original reason we wanted to start a podcast. You guys remember?
Yeah.
In our initial conversations, it was the healthcare concerns that were our initial reason why we wanted to do this. And the trauma stuff is all of this, like you said, it's kind of like it all works together in what we're talking about. But I just feel like this topic is so important. And with the baby boomers and all the stuff that they have going on right now, their families are the ones who are also dealing with all of this. Me being somebody who was a daughter of a baby boomer and, dealing with taking care of my mom and then her mom and then now my cousin and my dad's now almost 80. It's all, I feel like it's like that kind of, I'm the one kid of all four of the kids that is pretty much taking a lot of the responsibility on because I have the ability to travel and to work from wherever. Mm-hmm. The rest of them don't. So I feel like it's impacting me maybe more than any of them, but I've learned a lot in the last 4 years and, I'm better for it with all of that I've gone through on that side of it, as well as, just like estate planning and end of life considerations that, all that kind of stuff that I went through.
That is so important because I'll tell you what, in the hospital, I have seen it destroy families.
Yes.
And working with Kimberly when we did hospice together, I have just seen it destroy families. Like if you I say this with lots of love and grace, but if you just express to your family your needs and what your wants are, get it in writing and don't, so that they don't have to deal with all of that.
Take it off their plate.
Yes. The one thing my dad, he didn't necessarily do all of that, but my dad was so verbal. I mean, he had life insurance and all that kind of stuff, but he didn't really he expressed his wishes to us in that he did not want to be put on a ventilator. He didn't want to do all that stuff. And so when my dad got COVID and he was just terrified of it, for one. And when we had to make the decision to take him off life support, he I remember the day. He was, it was so tough because I had just been in Coeur d'Alene. I had just taken a travel assignment. The 3rd of January was when I started my job, and it was February 6th. No, it was February 8th that he passed. 6th or 8th. And I think it was the 8th. And I had to come back home. So it wasn't even that long that I had left. And I was working, and he was talking to me the day that they were coming in to put him on the ventilator. And I could just hear the fear in his voice. And when we had to come home, they kept him on so that I could get a flight home, and my sister could, she lives in Seattle. We all knew. My dad, you know, his family, his brothers were like, you got to do something more. He was very clear to us. He was very at peace with the life that he lived. He wanted to go. He said, if it's my time. A lot of his quality of life had been taken away. He had a stroke not too long before and lost some eyesight in one of his eyes, and he had to be on oxygen. All of his quality of life had been taken. Yeah. Everything he loved to do, he couldn't do anymore. And he was ready. He said, if it's my time, I'm ready to go. So there was not one thing that any of my siblings, and there's 5 of us, we knew that we had to let my dad go. And we didn't argue about it. There was nothing, because we knew his wishes. Even though he had not totally written it down, we knew what his wishes were. So express that, because he had expressed it to us. And I tell you what, if I had not done what my dad wanted, he'd be haunting me today. I know he would. So express your wishes to your family, to your loved ones, to your children, so it's very clear to them. Because we see it all the time. It tears families up.
It does.
You know, fighting over
money changes people. When there's a fight over money, it changes people significantly.
And I've
seen families get ruined over $10,000, and I'm like, $10,000
I have heard
your family.
I have heard family members say they're coming in here and they don't even care about me. They just want my stuff. I mean, it's just. Get it in writing. You are going to save so much grief and pain. And you're going to get what you want. You're going to get what you want.
Right. Yeah. Because that's who it's about, is you. It's not about how those kids feel, or it's about what you want. Yes, 100%.
Yeah. Well, this is an introduction to this topic. I think it was a good one today to kind of start having the conversation. And we're going to have guests. I have somebody that's in Opens hospitals. She's in hospital administration. She was a nurse. She's been in hospital admin for, I don't know, 10 years, 15 years. And now she opens hospitals all over. I think in Nevada, and it's a chain. I forget the actual chain. I would love to have her on here because she's part of hospital administration, opening hospitals, and to talk about incorporating these kinds of things into, you know, the administration part where people are taken care of, nurses and all that kind of stuff. I think that would be great. And we have somebody coming in about a month who has also been in hospital administration, but she's also on the patient side of it and advocating. Her biggest topic right now is advocating for yourself. She also has had stem cell surgery, I think. And so she's got some really interesting perspectives on it. But you guys, I know, Terry, you have some folks you want to bring in. So we will have experts talking about different aspects of this. And I think it's so important to do that, because I just feel like this is a topic that is going to impact all of us.
Mm-hmm. Absolutely. Well, till 2030, there's 10,000 people turning 65 every single day.
Yeah.
So, I mean, that's a huge amount of
big.
people. And now 65 isn't even that old. I mean, you know,
no,
it's not.
No.
You know, people are living into their 100s, and you don't even. I remember the first time I looked at a chart and I was confused. I was in nursing school because the woman was 101. I was like, what? You know, granted, that was 27 years ago, but now it's nothing to see somebody, you know, 100, 106.
Yep.
And you know, what's interesting about that as well is that I don't think any of these folks plan on living that long. So their retirement may not even cover the length of that they're living now, because they didn't plan to live until they were 95 or 98.
That's,
you know what I'm saying? It's like, that's also something they have to take into consideration, is making sure they can take care of themselves.
Yep.
It was so cute. I had a sweet little lady, and she says, gosh, I feel so old, you know, and She's 86. I'm like, oh gosh, just so cute.
You're just young, and 86 is even old anymore. I mean, it's just
It was so sweet. I'm like, you have lived such a good life. You're 86.
Yeah.
I feel so old. It was so cute.
Well, thank you guys for starting this topic with us, and we'll talk about it in the future. But do you want to have any lasting words, Terry, for nurses out there?
Just stay in the fight. Give yourself grace and take care of yourself. You're worth it. And more than that, your patients are worth you taking care of you. They get the better version of you when you're healthy.
Yep.
Absolutely.
Yes.
Yep, that's true. Yes.
Absolutely.
And so does the person on the road that you're gonna, that's gonna
stop real quick in front of you.
Everyone does. Everyone.
I know. Yes.
Everyone benefits.
All right, guys. Thanks so much for listening. Like, subscribe. Please share this with someone. If you have a nurse friend, or even somebody that's in home health care, or a CNA, or anybody, it'd be great if you would share this with them, because it's a topic we're going to keep having. Comment below if you want to hear about something in particular, or if you think there'd be a guest that might be a good fit for our podcast. We'd love to hear it. Comment below, or listen. Comment on. I moved us to a couple of other platforms, so we're not just on Spotify and iTunes, but I'm moving us to Castbox. And there's another one, I can't think of it right now without looking at it. But anyway, our podcast is getting put out there on other different channels. And so hopefully we'll get some different subscribers that way. So we'll see. Thanks so much, guys. We'll see you next time.
Bye.
Bye.